Hello, everyone, and welcome to another 2025 Clock Talk with Dr. Greg Brannon. How are you today, Greg?
Oh, fantastic. I'm on pellets.
Me too. Maybe the clock needs to be on pellets also so we can get this thing started. There we go. So as always, 15 minutes, chock full of information. So this is the year of the pellet for Optimal Bio. And
the world, 90 years.
Yeah, that's right. Happy anniversary.
Take it.
Yeah, 90 years. I don't think anybody knows that. Because I think there's a lot of information out there about testosterone these days, but I don't think people really understand the magic of the pellet.
Jim, I could go hours on this. All I think about is sex and muscles. It's so important for the immune system, the brain, the heart. When you say there are a lot of things, but there's two major hormones that affect every single cell in the body: thyroid, T3, and testosterone. Every cell. Let's get those optimized. That's the bottom line.
Yeah. So in my journey, I was resisted for a number of years. I know you resisted until 2012. And I remember having some friends that were going to the practice and they talked about how great it was. And I thought, weirdly, I don't want to do that. I don't want some little pellet going inside my body. But now I'm grateful that I do it.
I could outwork it. I could be harder. I could eat better.
Well, not only that, but it seems kind of weird, like it's surgery, but it really isn't surgery. So we talked in an earlier Clock Talk about the actual application of it. But now I want to talk about the stability, because I think like most patients, you really don't want to keep going to the doctor every week, every 2 weeks, every month. You kind of want to get something done and then have to worry about it for a long period of time. So what I love about the BHRT pellet is that for a man, at least, you're looking at 4, maybe to 6 months, where you're on a stable dosage of testosterone that literally takes 5 minutes to place inside a body. No stitches, by the way, no nothing. And you can live a normal life the minute you walk out the door, except for doing squats and maybe taking a warm bath for a night. So let's just talk about the beauty of the pellet from a stability standpoint, and then we'll compare the stability with other testosterone applications.
Because there are people out there selling shot a week, come to the office, charging, it costs $4 a month for these shots, and doctors are charging $300 a month. I'm not against making money, but it's like, they make it seem like it's easy. It's just inferior product. It's just inferior. The whole idea of stability is, can I take a testicle ovary and be transplanted in my body? That's the bottom line. There's a way to do that without taking a transplant, without getting somebody's testicle or ovary and stick it in their fat. The pellet release factor, it's the genius in which of the pellet. It's just the shape of the pellet, with obviously the crystalline way it's made. The shape is the beauty of its mode, its route. Because when it sits in there, the only thing that's allowing to dissolve is how hard your heart pumps to let this picture a sandcastle, and a little bit of wave comes by at a time. It's a little bit off the top. That's all this is at a steady state. And it sounds nerdy, but that's very important, because the enzymes in your body, they don't want this huge pile of hormone in. They can't keep up. That's the problem. When it's sitting there, it's a nice steady state. Your testicles make testosterone roughly every 15 minutes. A woman's cycle is different because their idea of their fertility rate, but even when they're in the non-fertility state of their life, their adrenal glands and their ovaries, it's a steady release. And that steadiness is just crucial on the overall homeostasis of the body. The ups and downs are the side effects. And especially when you have non-human, super physiological levels, that's where the bad stuff comes in. We don't have that. We're putting people into levels that your great-grandfather had. That's all. But the stability of this pellet allows it to release, again, I think it's a woman's roughly about 0.3% per day, and a man's roughly 0.7% per day. But also the beauty is, when you're very active physically, working out, heart pumping, you get a bigger rise. So if you're working out with no pellets, naturally working out, and you're working out, you get a rise as you work out. Deadlift, squats, you get a rise. The pellets mimic that. There's nothing that mimics the physiological. When you get a shot and stick it in, it's there. This big depot's there. And it's there, it's gone. No, creams rub off. All these things are just anti the way the body works. The key is to keep the body in homeostasis, and nothing does it better than pellets.
So in terms of homeostasis, you mentioned in previous Clock Talks the the prostate gland, for example, taking 90 something, right? And
nanograms per deciliter.
Yeah, it can never be oversaturated. It just takes enough and then it stops.
Right.
So is that similar then to other cell structures within the body where if you're on the stable pellet, then the cell isn't like pulling and searching for what it needs, and therefore doesn't get
I'm glad
stressed.
you brought that up, Jim. There's a great book by Dr. Thomas Friedman that talks about, it's called the hormone hypothesis of prostate cancer. Picture an 18-year-old boy. In theory, he should have higher testosterone. Say he does. Well, the prostate gland's saturated. It's warming. It's loving it. All the cells have all the fuel it needs. Now, for environmental reasons, plastic, whatever the reasons is, there's less testosterone. Now the cells hyperproliferate to have more prostate cells to grab. And it's very interesting is there are certain tumor markers that get really nerdy. The estrogen has an alpha receptor and a beta receptor, and there's a molecule called BCL. Cancer cells love BCL. Estradiol alpha receptors increases BCL. Estradiol beta receptors decrease it. Testosterone receptors decrease it. So the thing is the theory on this is when your prostate is saturated in testosterone, it's happy, these cells aren't proliferating. In fact, Dr. Friedman is using it for cancer, and this is, again, the book's 500 pages. The science is pretty cool. Where they're treating patients with prostate cancer, just the opposite of the standard of care. Higher testosterone, having great recovery rates. So I'm not a urologist for that.
Understand.
But the data is pretty compelling on a hypothesis, because it makes no sense. If testosterone caused prostate cancer, then why is 60-year-olds get prostate cancer, not 20-year-olds? So what is the milieu, the biochemical milieu of an 8-year-old? Well, we know one thing, it's anti-cancer. Why? Well, you know why? In the sense that it decreases BCL. It decreases these other markers that cancer cells love that protects them. So that's why it's important. One of the first lines actually to decrease cancer is cholesterol. And you have all these things that lower cholesterol. Cholesterol is the first step in our immune system. So all these things that work together, because if anybody says how the body works, they're lying. There's so much complexity in how this works. But the cool thing is that we know this. You affect this, it affects that. You have to always think through the cascade. So I'm trying to mimic our system as best as possible.
So getting back to that, if you're a male, you're looking at maybe 4 to 6 months.
Get placed? Oh, yeah.
Get placed.
They last about normal activity. And we have some guys that are, I'll say, professional athlete types. And they don't do it much faster because my algorithm compensates for that. But the bottom line is you peak in about 48 hours. I check in 1 month to see how you metabolize it. There's a complication sometimes in the pellet, since it is a trauma procedure. Your body makes these fibroblasts that like a cocoon over the pellet. When that happens, you're not releasing it. So you need that cocoon to dissolve. So massage and heat, that's about 2% chance. So I want to see how your body's responding at 4 weeks. Then in women, we check at 3 months, men at 4 months. And then we just reload them where they're at that case, because the goal then is to keep people within that healthy, normal physiological range. And this is what's important, Jim. Everybody that comes to us is within today's normal range. All of them. Everybody's in today's normal range. And they're all symptomatic. We get them to yesterday's range, 97% or better. Mm-hmm. So the ranges are a guidepost, but you can't, doctors today mistakenly look at a range called healthy. That range is a sick population. That's what's important to understand. Right. So what I'm trying to do is get data back from a generation that had less xenoestrogens. They're in heaven, so I can't use them, but the data's here.
Yeah, and what you do ultimately at Optimal Bio is you're not waiting for them to go back to, they come in, let's say, at 200 initially. You're not waiting for them to go back to 200 again to place them again. They're going to place them again when they're at, if it's a male, 800, 900.
Right, the study I'm using, Jim, there's a study in the 40s done on, this is a male part, done on Army recruits. So 18 to 30-year-old guys. And that range, ranges means 80% of people fall into that. Doesn't mean you could be higher than lower. If you're lower than that with no symptoms, that's okay. But I'll go to the data in a minute on that. And historically, under 300 is considered extremely low. Under 500 is considered low. Today they call 170 normal. Mm-hmm. Okay? So back to our ranges. So the range I'm using is 900 to 1400. So I reversed that. At 1 month, he's high, roughly around 1400. At 4 months, you're 900. Now reload you again. So you say that's the goal. So you get me. Now people are going to argue with me because they're not physiological range of today, but I can't stress enough. Today's the sick population, but these are human physiological ranges. So that, because you don't want to say it lasts 6 months to pellet. If I place you at 7 months, we're starting over again. The goal is to be that steady state, the stability of the pellet. And nothing can do that. There's a new one, I can't say it's new in America, it's not new in the world, called testosterone undecanate. It's an oral one. They push it. It's oral, no shots, no injections, no pellets. Only 3% is absorbed. And it has a half-life of 21 days. And the peak value is 800. That's the peak. That's not equivalent. Nothing equals a pellet other than your testicle.
All right. So you mentioned the oral. If you had to rank them, you got the pellet number one. What's number two?
To me, bioidentical cream.
Okay.
You do it, I'll say multiple times a day on the testicle, on the scrotum area, and you are the one that absorbs it correctly. That'd be my next one.
And that keeps the body stable as long as you're doing it every single day, or are you dropping precipitously each day?
You're dropping every day, but if you do it twice a day, you can actually help that out. Okay. That'd be it. If I had to do it, it's a non-bioidentical. It would be the shot, by the way. It'd be cyprinate, but it'd be in micro doses. It wouldn't be meaning every day or every other day. It would not be, the standard of care in America is one shot every 2 weeks. That's insane.
Because you're losing it.
It peaks in 3 days.
3 days, yeah.
And now you're miserable. And you're up and down, you're up and down, up and down. And again, the greatest study was the Zig-Berlin test. They found that 22% of men felt better. Pellet was 100%. The data is there, Jim. Again, a thing's been used for 90 years with 18,000 scientific journals out there. It's not even close, Jim.
Actually, side effects with our pellet.
There's no, again, when I say none, everybody's going to throw something, but there's no, heart's better, brain's better, bones better, everything's better, gynecological better, a male's better. All those things are better, but there are side effects. It's surgery in the sense of it's a minor procedure, but it's a blind procedure. I could get a hematoma, about 1 in 1,000. That's a small little blood bursting there. Infection in theory, I've done, again, 13 years, we never had an infection, but in theory, that's why I clean out. I do the cleaning technique. I was a surgeon for years. So the same technique I used if I was cutting your body open, I use the same sterile technique when I prepare the area. So if a pellet comes out, it stinks because it builds up pressure and pops out. They usually like 3 to 6 weeks after you get placed because it's just walking around. The gluteus puts pressure on it. So the side effects, you expel a pellet, but there's not a higher disease process.
Mm-hmm. When you say surgery in this case, there's no
minor by strict definition.
Yeah, you're in and out of the office in 10 or 15 minutes.
A woman is about 30 seconds. A man's about 3 minutes. So it's a minor procedure, but yes.
Right. And you can go live your everyday life the minute you walk out the door.
You've never stopped. And that's the thing about it, Jim, is like, if there's all these different routes, why would I want to cut myself? That'd be a reason. So in our new book, Restore, I have a whole chapter on why.
Well, I guess the bigger question is, why would you want to inject yourself if you're doing the shots?
Yeah, I've never done a shot, but I've given shots. Not for testosterone, but I've done gluteal shots, IM shots. They're painful. I gave penicillin shots when I was a resident. The needle's this big in the glute.
And there's clotting issues with those potentially?
It's what depends what you hit. Yes, the answer is yes. There's more chance of hematomas. There's more pain. You get infectious sites. I have some patients that come back after. Well, another thing with the shots. So how many we've done against, say, I don't know, 100,000. Say half those are men. I'd probably say 80% of the patients, men that we've placed, were on shots in their life. We've had nobody go back to shots or creams. Nobody. The men who actually put in their bodies for years, who liked it.
By choice, though. Because there are some people that, for whatever reason, that, as you call it, the pellet gets encapsulated. Mm-hmm. And maybe that, for some people,
that's the only reason.
Highly unusual, but they have to go to a different
or a body type that's extremely skinny sometimes, and it's just they like the shot. And I'm not going to knock on them because I know they're getting it, but we've had nobody run back because I think that's a superior thing. The way I like that, because of the way they feel.
Creams, you can't go touch things. You got to be careful where you work out, when you work out. You don't want to sweat it out, et cetera, et cetera.
And again, over time, 40% don't absorb anymore. And the big one, especially in women, 7 hours is gone. 7.
So what about the, I did hear that the patch seems to be the convenient thing to do.
Okay, patch. Let's go for a woman getting a patch. A postmenopausal woman who has a uterus. They'll give her estradiol via patch, give her progesterone by mouth. Great. But what's the most abundant hormone in the human body? Testosterone. So they don't even give that. But even those two, the patch itself, and how do you know it works? In women, there's a hormone called FSH. That's what they use, follicle hormone. We have it too, but for them, we measure for fertility reasons. In menopause, what happens is your ovary stops making estradiol and testosterone, so the FSH in the brain is continuously turned on. Trying to turn the ovary. It can't turn the brain on, but it's trying to turn the brain on. So any number above 23 means you're in menopause. Any person that comes on a patch or cream or anything else, the FSH is not affected. I give them a pellet, it drops in 2 days. Meaning no hot flashes. All the side effects of menopause go away because I'm mimicking the patient of being a 20-year-old. And that biochemistry is healthier, period.
To me, it's all about the pellet. Thank you for another 15 minutes and 10 seconds of Clock Talk.
No, thank you, Jim. I appreciate it.